Welcome back to another episode of RPEC On Air, a podcast produced by the Retired Public Employees Council of Washington. I'm your host, Alyssa Brady, RPEC's project coordinator. This episode is part one of our three-part series covering open enrollment for Medicare and also PEB, which is right around the corner. And today we've got two very special guests. I'm joined again by Tim Smolen, SHIBA Program Manager. Welcome back, Tim. Thanks for coming along.
Thank you.
Yeah, and we're also joined by RPEC Chapter 3 President and Healthcare Workgroup Chair, Matt Groshong. Welcome, Matt.
Hi, Alyssa. Hi, everybody.
Hello.
Thanks.
So yeah, Matt and Tim will be doing a deep dive into getting started with Medicare. But first, why don't you all tell us a little bit about yourselves?
Great. Thanks, Alyssa. Yes, I'm Matt Groshong. I've been an RPEC member since 2015. And before that, I worked for two community colleges. I'm the chair of the RPEC Healthcare Workgroup and the president of Chapter 3 in the Seattle area. I welcome you to our second year of offering our popular healthcare information sessions to RPEC members. Today's session is on helping those of you approaching the age of 65 to navigate the Medicare enrollment process. Our other two sessions focus on choosing the best medical insurance plan for you, both for those who get their insurance through PEB and those who do not. I'm very pleased to introduce our expert presenter today, Tim Smolen. Tim is the SHIBA Program Manager in the Consumer Protection Division of the Office of Insurance Commissioner in Olympia. The SHIBA program offers highly trained volunteers who offer one-on-one impartial advice on health insurance options for retirees like us. Tim says the best part of this work is knowing the impact of helping people, both in terms of saving them money and also in terms of putting their minds and hearts at ease. Tim has wide experience working in various Washington state agencies, including the Healthcare Authority and also private insurance companies. On top of that, he is a great friend and supporter of RPEC. Tim, thanks so much for your time and expertise, and I hand it over to you.
Matt, it's a pleasure to be back with you again. And of course, we're both benefiting this year from having Alyssa as our producer. So we're going to have a top-notch program, and I hope it's, a useful program. As you said, the joy of doing this work in the SHIBA program and the Office of Insurance Commissioner really is, kind of level the playing field a little bit, because a lot of people feel outmatched by the complexity of the program, and it feels super daunting. And anything we can do, as you said, to make sure that you're well informed, and then also that you can apply the skills you have from the rest of your life to these decisions, that's what it's all about. And it's very gratifying when we can help people. And I heard from you and Alyssa, Lori, that this program was helpful to people last year, so I'm excited to be back again. I think what we'll do, Matt, is just have the same kind of conversational format that we had last time. And now that we have Alyssa, of course, feel free to hop in.
Yes.
Committed to that.
I will be. Many questions, I'm sure. But yeah, so explain it to me like I'm 5 going on 62 or 65 or 67, whichever it is.
Okay. Well, as Matt said, this will be the first of 3 programs that we're going to do, and we're really focused in this program on that important step of either leaving work to start Medicare or deferring your Medicare insurance while you're continuing to work past age 65. So, there's a lot of complexity in the Medicare program, and a lot of different kind of ways that people get started, and then challenges of using the insurance. But for today, just for a simplifying assumption, we're going to focus on folks who are coming into the Medicare program by virtue of aging in, because that's about 85% of the population. There are about 15% of Medicare beneficiaries come into the program because they're disabled or they have end-stage renal disease. But we're going to focus in this program on people who are aging in. And we have a few high-level objectives for today. So first, of course, is that you know your rights and options, that you know where to turn to for help, whether that's the agencies that have official authority, or, as Matt said, one of our highly trained and motivated SHIBA volunteers. We want to make sure that you understand about being on time. Most people don't know very much about Medicare, but the specter of being late and having late enrollment penalties is ever present for them. And then to understand what it means to be on time and why being on time and getting it right the first time matters. So, for me, maybe the metaphor about getting ready for Medicare is like, if we can help you see kind of what's on the horizon and the way that you might think about a weather forecast, helping you know what to pack for your trip, then maybe you'll feel a little bit more prepared to do this. So 2 things, I think, Matt and Alyssa, that I would say about Medicare that people might not know that will be important for them is that most people in Medicare have other insurance besides Medicare. So there's broadly, there's kind of this mythology that Medicare takes care of everything and that it's free. And neither one of those things is true. So whether you're going to enroll in a commercial market plan, if your business doesn't offer a group plan, or if you choose not to do that, or if you're going to enroll through a group, like through the HCA PEB products for state retirees or folks coming out of the school districts, you need more insurance than Medicare. How I generally describe Medicare is as if it's major medical insurance. So it doesn't pay for everything you need. And for the things that it does pay for, it doesn't pay them 100%. So you're for sure going to want to think about getting some other insurance to get all the services you need and to minimize your out-of-pocket costs when you need to get treatments or services. So generally, when you're working, it's a little bit like a crock pot, right? It's kind of set it and forget it. And open enrollment comes and goes, but you're probably not paying much attention. And unfortunately, you really have to be an informed, engaged consumer to get the most of your Medicare benefits, especially if you're not in a group, but you're in the commercial market, because those plans change quite a lot year over year. And so we really want to encourage you, although it can feel a bit overwhelming, to engage with the subject about what your rights and options are and how to do that. So for people who have the option of being in a group insurance plan, I would strongly recommend that you consider doing that. And I'll tell you why. For most people, the coverage that you're going to get from your group is better than the coverage that's available in the commercial market. And by better, I mean it's more comprehensive coverage. It has a broader network of doctors and hospitals and pharmacies, and it has enhanced prescription drug coverage, by which I mean more drugs are covered and you pay less in terms of copays. Another reason to think about group insurance is that you're going to have more rate stability. I know for our friends and colleagues who are enrolled in the PEB plans, it's been a really tough couple of years as we've faced double-digit rate increases and lots of changes in the Uniform Medical Plan. But I can assure you that there's just as much turmoil in the commercial market as there is for those of you who are in a group plan. So don't feel like you're being singled out. This is just all of us, as Matt said, he's the healthcare chair. We're all just watching as we move through some real significant changes in the healthcare economy. So you're going to have to just be prepared for this to continue for a little while longer. One other note for our friends who are eligible for a group insurance plan, as you think about your retirement options and benefits and financial planning, as a general rule, if you don't elect to join your group when you're first eligible, you won't be able to come back later. And that's not specific to PEB or the state of Washington. That's just generally a rule about how group insurance plans work. 2 other things that you want to think about is that the choices you make about your insurance could affect other what we call post-retirement benefits. So if you opt out of medical insurance, you may be opting out of dental or life or other kinds of insurance options. And opting out may have consequences for people who are covered as dependents on your insurance. So please make sure that you understand about that. So first significant point of contact, obviously, whether you're in a group or not, is please check in with your HR or payroll or benefits office about what your rights and options are, about the deadlines that they have, about the forms they require. These people are experts and they really want to help you. They want this to come out great for you. So, 6 to 12 months ahead of time, be checking in with the people at your agency that can help you navigate the rules in place for your particular agency. I know, Matt, from talking to you, that this was very important and helpful to you.
Absolutely. I did not have the information that you are giving us now, but I fortunately had an excellent HR benefits specialist, and he walked me through the entire process. He did a great job.
That's excellent. So what you're going to hear in this program today is Matt and I are going to provide some, kind of a checklist for you of things that you can think about. So at this place, we're talking about what's on your checklist for your conversation with your HR or payroll or benefits specialist. And the two things that I would say are top of mind there are, do I have the option of continuing insurance as part of this group or not? And then if I don't join now, what options, if any, do I have later? And the choices I'm making now, how do they affect me in terms of other post-employment benefits or dependence on my coverage? I think for most of the RPEC audience, for sure, folks who are in the HCA PEB plans, the Department of Retirement Systems is also going to be a key partner for you here. If you haven't attended one of their seminars for pre-retirees, I would strongly recommend it. Like RPEC, they also have a terrific series of podcasts and a great web presence. So be sure to check in with them. Believe it or not, retirement from state government is a process. There's steps that you have to follow, and the folks at DRS are going to help you make sure you navigate that successfully. Obviously, this is beyond the scope of the conversation for me and Matt, but there are rules and ways to optimize your benefits in terms of things like service credits and your anniversary date of service and things like that. So be sure when you have that conversation with DRS, you're asking about, how can I protect my rights and options? How can I optimize the benefits that are available to me? And how can I best make the best deal for myself and my family while I'm alive, and then for survivors' benefits after my death. So then let's pivot a second and talk about health insurance and folks who are moving into the HCA PEB portfolio of plans or another group insurance plan. Another kind of key takeaway for today's program then is going to be that if you're enrolled in a group, the group makes the rules for things like getting started and deadlines and forms, and they have their own open enrollment period. And so you are obviously enrolled in Medicare, and the Medicare rules all still apply to you, but the rules for the group are also significant, and they take precedence in terms of things like the annual open enrollment period, which for this year, we're going to have a departure. Matt, you and I have talked about this. PEB is changing the dates for their annual open enrollment period. And they're going to do their best to reach people with that. But we're hoping that this podcast can also help remind people of those deadlines.
Yes, I will double check those. I know that the deadline is going to end prior to Thanksgiving. I'll double check.
Yeah, I have them. So Medicare Open Enrollment, October 15th through December 7th, and then PEB is October 28th through November 25th.
Great. Thanks,
Yeah.
Alyssa.
Yeah.
You see the
I know
difference
some
there,
things.
folks. There's a big difference in open enrollment dates, and it's easy to get them confused, right?
Of course it is. Of course it is. So let's talk about eligibility and enrollment in general then. Again, this is going to apply both for people who choose a group plan and for people who enroll in the commercial market for Medicare. So eligibility for Medicare is actually determined by the Social Security Administration. So the folks at Social Security are going to be a key point of contact for you. And as I said, in general, eligibility for Medicare is about people who are over age 65 or disabled or have end-stage renal disease. And our program today is going to focus on those people who are aging in. I'm going to advise, if you haven't already created a personalized account at ssa.gov, it's absolutely worth doing that. And I'll tell you 2 reasons why you might think about doing that. Obviously, forecasting your benefits. You'd like to know what's your full retirement benefit going to be, what's a reduced benefit look like, what's an amplified benefit look like for waiting. It's also a terrific way to protect yourself against fraud and identity theft. They have a very strong presence in that space. And you can also designate someone to help manage your account now, so that later, if you have a cognitive decline or a cognitive impairment, it's already in place for someone to help step in and support you with making those important decisions that affect your retirement benefits. So I'm going to do then 3 important facts about Medicare and other insurance for you. So the first is that your Medicare eligibility is going to start when you're age 65. So using myself as an example, I was born April 6, 1963. I'll be 65 on April 6, 2028. So my Medicare benefits will start on April 1st, 2028. The second fact for us to remember is that our decision about when to draw our Social Security retirement benefit is independent of turning age 65. For me, my full Social Security benefit will come at age 67. I can draw a reduced benefit as early as age 62, or I can wait past age 65 and benefit from a delayed retirement credit, which means that my monthly income would be higher than starting at age 65. But full retirement and Medicare age are no longer the same. The third key fact is that our decision to start Medicare is not only about turning age 65, it's also about whether we'll continue to be working and covered under an employer group plan. So with that, I'm going to offer us 2 scenarios or 2 personas to consider. The first is our friend Sue, who is going to retire at age 65. She plans to enroll in HCA PEB Medicare coverage and choose one of the excellent employer plans that are offered to PEB Medicare retirees. Now, how she gets started depends upon whether she's already drawing her SSA benefit or she intends to at the same time, because she may be waiting to draw her Social Security benefit. If she started her SSA benefits at least 4 months or more before she turns age 65, she's going to be automatically enrolled into Medicare Part A and Medicare Part B. The effective date of her coverage will be the first day of the month she turned age 65, and Social Security will send her red, white, and blue Medicare card in the mail to her. On the other hand, if she has not yet started her Social Security benefits, for instance, she's waiting until age 67, then she's going to need to take action to enroll herself into Medicare Part A and Medicare Part B. The easiest way to do this is online at the SSA.gov website. Certainly you can call. There is paperwork, but it's much easier to do this online. So here comes our first important deadline then for being on time. Sue wants her Medicare coverage to start, whether Medicare initiates it or she does, on the first day of the month after her active coverage ends. Our goal for on time means no break in coverage. And Matt and Alyssa, let me stop there and ask if you have any questions.
Yeah, Tim, I was gonna break in here anyway. That it's so important. I think folks should play over these scenarios, repeat them until they sink in. There's so many people who think that Social Security dates and Medicare dates, age dates are the same. There are people who think that you get enrolled in Medicare automatically. There are all sorts of misconceptions out there. And whether you are working and continue to work, or whether you're getting Social Security benefits at 62 or 65 or 67, all of these scenarios that Tim is giving you are truly important in making sure that you have done the correct thing with Medicare, because if you don't, you're going to get hit with big penalties.
Tim, this is something that SHIBA volunteers can help folks with too when they are getting ready, yeah?
Yes,
I wanted
thanks.
to plug SHIBA again. Yeah.
Thank you. Thank you for the
Mhm.
plug. Yeah, this is, as you know, as Matt said, it's confusing, and it's kind of, there's this mythology out there, which is not unreasonable, because there was a time when they were the same, right? You got your Social Security benefit at 65, you got your Medicare benefit at 65, and so that was true once, but it's not true anymore. And yes, this is exactly a thing that SHIBA volunteers would be happy to help you to navigate. Okay, then I'm gonna pick up then with my second scenario.
Mhm.
So Matt, thank you for that. And our second scenario then is this is certainly on kind of our top 10 list of questions that we get all the time, which is about, what if I want to keep working past age 65? So let's have a scenario or a persona where we have a person, Paul. He's enjoying his work and his team, and he'd like to keep working past age 65, probably at least until age 67, to optimize his Social Security benefit. So currently, he's not drawing his Social Security benefit. And because he's not, he doesn't actually have to take any action at all. In the next segment, we're going to talk about when he does need to take action and how to avoid penalties for late enrollment and other heartache that goes with that. For now, the key is that because he is covered as an active employee through an employer group health plan, he can defer enrollment in Medicare. So this applies both to folks who are already in the HCA PEB system, or people who are in other city, county, municipal governments, or the school districts. As long as you're enrolled in a group plan and continuing to work, you can wait to enroll in Medicare without penalty, knowing that as we move into the next program, we'll talk about how to do that sort of on time. What that means is, because he's not drawing his Social Security benefit, he will not be automatically enrolled. So he's not going to hear from Social Security because he's not drawing a benefit. So when the time comes, again, he's going to have to take affirmative action to sign himself up. So with that, let's do a little bit deeper dive about how the Medicare program is organized, because it's going to help us understand this decision about deferring Medicare enrollment.
Tim, I
So
remembered my question, and again, it might be a tangent and I can cut, but going back to, you mentioned that it used to be the same for Medicare and Social Security. Did that change, with, like, there's concerns with the trust fund of Social Security and Medicare, and so they kind of changed the retirement ages. Is that where that kind of went off?
that's 100% what happened, Alyssa. Right.
Okay.
It was a decision to kind of improve the long-term forecast for the Social Security Trust Fund, right? It was an alternative to increasing taxes or reducing benefits, was to push the age of full retirement.
Gotcha. And I've written a little bit about that stuff. So yeah, it's very interesting. But
Yeah.
continue. Thank you for
Yeah.
that.
And I'll just say, as an aside, and I hope this is not confusing, but you see a similar thing happened in the Medicare program for folks who are relatively high income earners. We historically have had what we currently refer to as the standard premium for Medicare Part B. But again, to help secure the long-term future of the Medicare program and to not have, extreme rate increases for everyone in Medicare, we did, it has the unfortunate name IRMA, IRMMA, which stands for Income Related Monthly Adjustment Amount, so that relatively high earners in Medicare pay more than the standard Medicare Part B premium. So in the way that Social Security kind of adapted to this, fiscal reality by moving the retirement age, the Medicare program moved there by, for a small percentage of the whole population, having a relatively higher Part B premium, so that we didn't have generally the same kind of rate escalator.
Yeah. Okay. Good background.
So good on you. Okay, so let me introduce our friend Paul then to the Medicare system. And for our listeners, let's take a look at how the Medicare system is organized. I'm going to describe for you 3 markets, 2 systems, and 4 parts of Medicare. We'll have a graphic image. I know Alyssa's going to work on getting some images loaded to the website to accompany this program. But I think I can narrate this for us as well. So by parts of Medicare, this may be familiar to you already. So Medicare Part A means hospital or inpatient insurance. Medicare Part B means medical or outpatient insurance. Medicare Part C means Medicare Advantage plans, which you may also have heard of as Medicare health plans. And Medicare Part D means Medicare prescription drug plans. So Part A, hospital, Part B, medical, Part C, Medicare Advantage, Part D, Medicare prescription drug plans. And then these are then organized into two systems of care. So again, you may have heard the expression original Medicare or traditional Medicare or fee-for-service Medicare as one alternative, and the other being Medicare Advantage, or you'll also hear this referred to as Medicare Plus Choice. So again, we'll have a graphic for you, but just in your mind's eye, imagine, the exercise about draw a line down the piece of paper, and on the left-hand side, original Medicare, on the right-hand side, Medicare Advantage. So we're going to, on the left-hand side, then original Medicare, we're talking about Medicare Part A, Medicare Part D, and Medicare Part A, B, and D plans. And on the right-hand side, we're talking about Medicare Part C plans. So the last part of this conversation then is about three markets, and I'm going to refer to those as employer group health plans, commercial market plans, and plans that are sponsored by Medicaid and run by state government. So again, what we're talking about is kind of where are you situated as you come into being eligible at age 65 and enrolling in Medicare. So you may be coming out of an employer group and have the option of continuing in group coverage. You may be coming from a place that doesn't currently offer benefits or that doesn't continue to offer benefits to retirees in Medicare. So then we're talking about commercial market plans. Or you may be a person who is already enrolled in one of the qualified health plans. So we're talking about Obamacare or the Affordable Care Act or the Health Benefits Exchange. Or you might be enrolled in Apple Health, which is our state's Medicaid program. And you may be continuing with those benefits after you become eligible for Medicare. So in the second and third programs, as Matt said, we're going to spend quite a bit more time talking in detail about your options in each of those markets. But for today, we're going to just focus on our friend Paul and this question about can he defer, why would he defer, and kind of what's behind his decision or his motivation. So I've got 4 questions. Go ahead, Matt.
And yeah, Tim, just to repeat something that you said that seems so important, and I'll repeat it and make sure that I understand what you say. If you are currently employed and you are passing the age 65 threshold and you have insurance through your employer, you do not have to do anything with Medicare. Is that true?
That is true, Matt.
Okay, great. That's
well, before, sorry,
a
go
simple
ahead.
thing.
Yeah, well, before Paul asks the question, I had a question, and it might be, I don't know, common knowledge for folks that are closer to retirement. I don't know, but I often see Medicaid kind of divorced from Medicare when it's talked about as if it's something totally separate. So I didn't really realize that it is part of Medicare still.
Yeah, so thanks. I really appreciate that question a lot, Alyssa. And no, it's not common knowledge. In fact, what's more common is that when we ask people what kind of insurance they have, they don't know. And they say Medicaid when they mean Medicare, and they say Medicare when they mean Medicaid. So there's no common knowledge whatsoever about this. So it is the case that Medicare insurance, going back to our kind of brief review about getting started, people age into Medicare, right? So eligibility for Medicare generally is about being age 65. Being eligible for Medicaid programming is about being a person with relatively low income. And so again, if in your mind's eye, you imagine kind of a classic Venn diagram with two overlapping circles, we have some people who are just in Medicare, and then some people that have both Medicare and Medicaid insurance. And we refer to those people as dual eligible people. So they're eligible for both Medicare and Medicaid. And in general, then what that looks like is that they're getting financial support from the state for the costs of the Medicare insurance program.
Oh,
Okay.
So in effect, the state is acting as if the way that a group or a commercial market plan might work.
Okay. Good to know. Well,
So
back to Paul with Paul's questions.
Yeah. Yeah, so let's do Paul, because we do for sure want to talk, well, I for sure want to talk some more about Medicaid and Medicaid programs that can help even people like Paul or like Sue, even if you are in a group plan and even if you are a retiree. The reality is that for a lot of people, the money they were earning when they were working loses its purchasing power over time. And so, when we talk about people being on a fixed income, there are going to be people who will qualify for public assistance even though they have a pension, or even though they're retiring with a Social Security cash benefit. So we don't want to leave them behind. And I do want to talk about that some more before we close today's program. So let me just set the stage one more time for our friend Paul then. He is currently working. He likes his work and his team. He'd like to continue working. In general, his motivation probably is that he wants to wait until he can draw his full benefit at age 67. So he's going to continue to work past age 65 without having enrolled to receive a cash benefit. And so the couple of questions then that occur, right, to people are, why would he not enroll now? Isn't that risky? Isn't he going to face a penalty? Also, why would he potentially enroll in Medicare Part A, but not Medicare Part B? Why was he not automatically enrolled in Medicare at all? And what are these distinctions about A, B, C, D in terms of enrollment? So if you'll just bear with me here, I'm going to do a quick kind of backgrounder to get us oriented to how Medicare works and the advent of A, B, C, D programming and enrollment. So the Medicare program is actually a pretty new program. It was enacted into federal law in 1965. It amends the Social Security Act, and it came online in 1966. It's modeled on and works a lot like Social Security, which is why the Social Security Administration manages eligibility and enrollment. Since the beginning, Medicare Part A has not had a monthly premium for people who have contributed enough in taxes that they paid when they were working. So Alyssa, a very smart question about Social Security earlier. Like Social Security, Medicare Part A has what we call the Medicare Part A Trust Fund, so that when you're working, your taxes then are invested in the trust fund, so that when you become age 65, for most people, there's no premium because they contributed to the fund while they were working. On the other hand, Part B is now and always has been voluntary and requires a monthly premium contribution from the beneficiary. In 1966, it was the grand total of $3. And as we are talking here in 2024, it's $174.70. So you can see that there's been, a pretty significant medical inflation here. So the first part of the question that Paul has is about why defer Medicare Part A but not Medicare Part B? Why defer Medicare Part B but not Medicare Part A? And the answer is because in general, Part A is for free, but Part B has a substantial monthly premium. And the second part of that answer is that when you're working, your employer group health plan pays first and Medicare pays second. So you're unlikely to get a good value because your Medicare coverage is going to pay second, and generally it's not as good as your group insurance coverage. So you'd be hard pressed to justify paying the $174 a month. So then how about Medicare Part C and Medicare Part D? So again, like Medicare Part A, these are strictly voluntary enrollment. So for Part B, you need to opt out. Social Security is going to enroll you unless you decline if you're already drawing benefits. Conversely, for Medicare Part C and Medicare Part D, you have to opt in. And why is that? Well, the reason why is that Medicare Part C and Medicare Part D are offered through private insurance companies under contract with Medicare. So it's not a simple yes, not right now, or no answer. You actually have to consider that there's many options and choose the one that best fits your need, right? So I'm generally talking here about rules both for people in employer group health plans, as well as people in commercial insurance, as well as people in Medicaid. So this really is like a full contact sport, right? It takes full engagement. You're going to have to invest some time and energy and effort into finding the best plan for you, because the Medicare program is not going to be making that choice for you. And let me stop here again and see how we're doing and what questions, Matt and Alyssa, you have.
So, Tim, when someone continues working past 65 at a place with a group employer health coverage, doesn't your employer want you to sign up for Medicare as soon as possible so that they pay less in premiums, because then Medicare will pay part of it?
Matt, that's a great question. And the answer is the group doesn't really benefit until you retire. But
Aha.
at the point that you retire, it's almost universal that you're going to be required to sign up for Medicare Part A and Part B as a condition of staying in the group. And that is exactly, your intuition is exactly right. It's because the group is going to save, I'll say, a mountain of money, because now Medicare will be your first insurance and the group will pay second.
Okay, thanks.
Yeah, thank you. And
think
Alyssa, how about you?
So, they need to start this or a little bit before they turn 65. Regardless of if they're going to retire at 67, but the clock starts at 65 for Medicare. That's something I'm still trying to kind of piece together.
That is such a great question. Why don't we take your question as the starting place for where we go next? Because that's your instinct or your intuition is just exactly right. So, and I know this can be hard for people because they think of Medicare like it's the government, and it literally is the government. But I think this is easier if you think about it for a second as if it's an insurance company, right? And so when you think about how insurance works and how insurance companies work, the fact is that we need you to sign up when you're eligible. Because if we let people wait to sign up until they knew that they needed expensive care that the insurance company would pay instead of them, that would break the system, right? So we need to collect monthly premiums from people as soon as they're eligible, so we have enough reserves in the system to pay claims for everybody when they need it, right? That's kind of just a basic precept of insurance. So you'll often hear this referred to and I'm sure what's meant to be a humorful way, like, we can't let you buy house insurance when your house is on fire. We need you to buy house insurance when you take possession of your house and pay premiums, even if you never need it, because that's how the system works. Well, the same thing is true about the Medicare program. We really need you to enroll when you're first eligible at age 65 so that the system has integrity. However, Medicare is willing to make an exception if you are covered under another insurance program that's as good as the Medicare program. So in other words, Medicare is going to feel okay about you enrolling later as long as during the period in between you were enrolled in a coverage that was as good as the Medicare program. In other words, if you wait between 65 and 67, as long as you can prove that you had insurance from the place you were working, then you're going to be okay. You're not going to have a penalty for being late. Does that make sense?
Yeah, it does make sense. Thank you.
Yeah, you're welcome. So again, I'm going to come back to like 19 times in this program say, but you have to be on time. So, for Sue, being on time means no break in coverage, start your Medicare coverage the day after your group coverage leaves. For Paul, what we're going to see is the same general rule applies. Start your Medicare coverage on the first day after you're not covered by your group anymore, but you can wait to do that until you leave your group. In Paul's case, in a couple of years. And I'm going to also just refer back to the kind of conversation between me and Matt that in general, not only does Medicare care deeply about this, but so does your group. Your group is not going to let you wait to sign up for the group or to sign up for Medicare. They're going to have the expectation that you sign up for Medicare immediately when you're getting ready to retire, and immediately when their coverage is ending. Again, the motivation is about the savings that accrue to the group because Medicare is now the first payer. So you're going to have for the group, and I'll say HCA PEB, for instance, you're going to have proof of enrollment in Medicare Part A and Part B. And for the Medicare agency, you're going to have to prove that you were continuously covered by your group. So in Paul's case, he's going to have to submit a proof to the Social Security agency that was provided by his company that he was in fact covered by that company continuously starting at age 65. So a little bit of technical jargon now, then I'm going to introduce you to some Medicare kind of Medicare technical speak. So first we're going to say initial enrollment period. So Sue is the person who is using the initial enrollment period. That's the time when you're turning age 65. And as I said at the head of the program, Sue can actually enroll a little bit ahead of her 65 birthday because her initial enrollment period is the 7-month period that is 3 months before her birthday month, and the 3 months after. Now, again, I'm going to say, don't wait until after 65, sign up before age 65. And if you're auto-enrolled, then that's easy. If you're not auto-enrolled, then take action to enroll yourself. But we really want you to start your Medicare benefit during that initial enrollment period, unless you're going to be continuously covered by a group. Because if you miss that initial enrollment period, you will be subject to late enrollment penalties. Now, in Paul's case, he's going to use what we call a special enrollment period. And he's allowed to do that because he's going to provide proof that he was continuously covered under a group. The special enrollment period for people who work past age 65 is 8 months long. It starts the first month after you retire. So as long as Paul enrolls himself into Medicare Part B within that 8-month period, he will not be penalized. Now, again, I want to make the distinction here between rules for Medicare and rules for your group, and Tim's rules, which say no break in coverage. So I want Paul to plan ahead and start his Medicare Part B insurance on the first day of the month after he's no longer covered by his group. So if the group is going to give you 60 days, you're going to have a 60-day break in coverage. Don't do that. If Medicare is going to give you 8 months, don't use the 8 months because you'll have a break in coverage. Don't do that. So I'm telling you the 8-month rule because it's literally the law, and it's when penalties start to accrue, but you don't want to face a break in coverage. So again, plan ahead. If you're an online person, that's ideal. Use the ssa.gov website, but make sure that your Medicare coverage starts the first day of the month after you're no longer covered in the group. So if you're using your IEP or your SEP, initial enrollment period, or special enrollment period, the goal is no break in coverage. And let me stop here, Matt and Alyssa, and ask for questions.
Yeah, I have one. I believe, without getting too much into the weeds here, that people who have started Social Security, let's say at 62, and then they're going to be automatically enrolled in Medicare at 65, there are cases in which the card is sent back, correct? That you don't want to be automatically enrolled in Medicare. Isn't that true?
That is true, Matt. Thank you for that. That's an excellent point. Yes. So if we'll create a third persona here, and we'll call him Matt. So if Matt was a person who for whatever reason, wanted to start his Social Security benefits while he was still working, then when he got to age 65, as with Sue, Social Security is going to send you your red, white, and blue Medicard in the mail, and then you need to return it back to them and say, thanks, I'd like to wait to start my Medicare Part B insurance until I retire and leave my group. Because if you don't do that, then they're going to auto-enroll you, and they'll deduct that Medicare Part B premium from your Social Security check. So yes, you're right, Matt, you would have to decline or defer when they send you the card. And then I'll say, my person, Matt, who is going to work past age 65, when he then retires at age 68, then he will be issued a new Medicare red, white, and blue card. And what you'll see on Matt's card is that he has a different effective date for Medicare Part A than Medicare Part B. So his Medicare Part A effective date would be his 65 birthday month, and his Medicare Part B effective date would be the first day of the month after he retired from his group.
Great, thanks.
It's a great question. Alyssa, do you have a question for us?
Well,
here?
I did, but actually Matt's question kind of answered it. I was going to ask about, still working, but drawing Social Security when you're 62. And you can do that. So yeah, that was the clarifying question that I had. So thank you. I'm good.
You can absolutely do that. And let me just say that this is a place where for sure be in touch with Social Security or a financial advisor or a financial planner, because Social Security benefits are taxable. So just be aware of the implications for you of drawing your Social Security benefit while you're still working in terms of how it affects your income taxes.
Well, now I have another question about Social Security. Maybe we need to do something separate specific to Social Security. But there's the reduced benefit if you go ahead and draw from it when you're 62. But let's say you're still working, and what's the age now? 67. So let's say you decide you're going to retire from your work at 67. And do you then get the full benefit from Social Security if you were to do it that way?
The answer is yes, you would get your full benefit.
Okay.
And at that point, then you're, assuming you're getting a cash retirement benefit, as well as your Social Security, both of those are considered taxable income.
Okay. Gotcha. Cool.
And
so many options.
Yeah, Alyssa, you can also elect to wait until you're 70. And the longer you wait to 70, you get about a 8% increase in benefits per year that you hold off until 70. Some people can, some people can't, but at least the option is there.
That's exactly right, Matt. So I think that I'm ready to go into then reviewing, right? Our friend Leanne Prelip over at the Washington Education Association Retirees, she's very fond of tell them what you're going to tell them what you told them. So here comes the wrap up then. Okay. So in today's program, leading ahead to next program, what we're trying to reinforce is about getting ready for Medicare. And the first important takeaway is knowing about when you'll be eligible, which for most people is age 65, which is different than when you're eligible for your full Social Security benefit in many cases. The second important point is to know whether you're going to be automatically enrolled or not. And in general, auto-enrollment applies to people who are already receiving a cash benefit. And if you're not, you're going to have to take affirmative action to enroll yourself. And, just being clear about the consequences of that for you. The next kind of key takeaway is that the agency that manages eligibility enrollment is Social Security, and it's in my judgment, it's wise for you to consider making a personalized account now ahead of when you're going to need to use it, and online is the easiest way. If you want to wait to start your Medicare Part B benefits, then you're going to need to be corresponding with the Medicare agency, the Social Security Administration about that. As Matt said, if you're drawing benefits, you need to decline your card. If you're not receiving benefits, then you can wait, but you're going to need to take action during the special enrollment period to sign up. If you are enrolled in a group plan for retirees, so for instance, the HCA PEB plan for people that came out of state government or the local school districts, the group has its own rules about being on time and its own forms and its own process. And so we talked about things like you're going to have Medicare Part A and B and prove it to them. And we talked about the fact that every year they have their own open enrollment period that's different than the Medicare open enrollment period. So please be aware of that. And then, of course, Medicare has its own set of rules about eligibility and enrollment and being on time. But please mostly pay attention to me and focus on not having a break in coverage, even though your group or Medicare might be more permissive. I really, really want you to think about the fact that not having a break in coverage is your best way to go. There are lots of options for insurance, both in groups and in the commercial market. And Matt and Alyssa and I are going to take some more time to talk about that in subsequent programs. But in the meantime, it's not too early to check in with your HR or payroll or benefits office. For sure, your colleagues at the Department of Retirement Systems are excellent and expert. If you are enrolled currently or will be enrolled as a retiree with the HCA PEB, it's absolutely smart to familiarize yourself now with how that all works. This year, there'll be a series of 19 in-person benefits fairs around the state. The first 4 are sponsored by our friends at the UW Retirees Association. I would encourage you to consider checking those out if you're able to do that. And obviously, shameless plug for our program here in the Office of Insurance Commissioner as a free, unbiased, confidential service. We offer the SHIBA program, and the professional staff here train volunteer advisors who will be happy to meet with you one-on-one, in person or on the phone or in Zoom. So please consider us a resource to help you navigate through these very complex systems so that you can feel like you didn't miss anything and you can have the peace of mind of knowing that someone else in the world cares about you and wants this to come out good for you. So with that, again, Matt, let me thank you. It's always a pleasure to work with you. And Alyssa, welcome to our little tag team here.
The inner circle, I'm in, finally.
Just a quick question though. If you retire and then you are covered under a spouse, that counts as being in a creditable coverage plan, and you don't have to sign up for Medicare right away, correct?
Correct. Alyssa, did you see how Matt slipped into that Medicare technical jargon there and said creditable coverage, where I just said as good as Medicare earlier?
Right.
He's showing off a little.
No.
Yeah. Okay, so those are the same thing.
This was in your notes, Tim, and I just saw it because that's exactly the question I had when I retired. I went on to my wife's plan and I was going, what does this mean with Medicare? What's going to happen? Are they going to ding me for being without coverage for a certain time? But yeah, so.
No, that's a very insightful question. It kind of goes back to the question that Alyssa asked earlier about like, why is being on time important, and what about if you want to keep working? And that, yeah, so creditable coverage is that expression that is the right technical term. So proving that your coverage that you had in between was as good as the Medicare coverage that you're stepping into. And I think for most people, that expression creditable coverage became sort of top of mind for them with the advent of Medicare Part D, right? Because you had to sort of prove that your group coverage was as good as the Medicare Part D coverage to avoid having a penalty. So that expression kind of became part of our, for those of us who work in the business, a little bit more familiar. But it's always been the case for Medicare Part B coverage, but it wasn't as widely known. So good for you, Matt.
Well, you had it in notes, and so I was just following your excellent brain on this.
That's very kind.
Yeah.
Well, how about other
ahead.
questions before we wrap up?
I can't think of anything for now, but I know for the next two programs I will have plenty, I'm sure. And yeah, I wanted to mention again that there will be a PowerPoint accompanying this, and you can view that on our website. Once all of this is ready, we'll have a landing page that has a lot of information about open enrollment. So stay tuned for that.
Yes, and this session sets listeners up, new retirees, if we want to call them that, sets them up for one of our next two sessions. And one session is going to be for people who are going to go into the PEB group, one of those group plans. And the other session is going to be for folks who are going to be buying their insurance directly from an insurance company through the commercial market. So we got you covered either way.
We sure do. Thank you all. I really appreciate, the time and the care you all are taking to do all of this for people, because it definitely sounds like if you miss a step or just one thing is off, it can be really catastrophic for people. And it's something that's not really common knowledge or that you would really assume either. And which, I mean, it's unfortunate. Does it have to be this complicated, Tim and Matt? Does it have to be?
Every year, that's my conversation with my mom, Alyssa. Why is it? It shouldn't be like this. I'm old. It shouldn't be this hard for old people. And she's absolutely right. And the answer is no, it does not have to be this hard. We're making it harder than it needs to be. And so on behalf of the Medicare agency, I apologize.
Thank you. All right. We've plugged SHIBA a couple of times. And listeners, if you would like to be trained on Medicare really deeply, then you could consider being a SHIBA volunteer and using your newly found Medicare knowledge to help other people navigate it.
Yeah, well, thanks for that, Alyssa. I would say that, not to, profile our volunteers or reduce to stereotyping, but a very common way in for people is that they started to navigate this themselves and appreciated how difficult it was and reached out for help, or they were helped by our volunteers, and they were so grateful and they wanted to give back. But there are people for whom, it's sort of a side benefit to continue to learn about it and have sort of like insider knowledge and insider insights. So we're always welcoming new volunteers and people who are coming to us through the RPEC, already are career public service people. So they already, kind of have the heart and ethic for service. And many of them were teachers like Matt or educators. And so, you have a lot of good experiences to bring to bear and helping other people comprehend complex subjects and, kind of help people apply their native intelligence. So we welcome all comers, but we're especially excited to have people who come out of public service and education join us.
Could you give us the phone number for SHIBA real quick? I don't have it on me.
Of course. Our phone number is 1-800-562-6900. And you can find us online at insurance.wa.gov. And I guess I'll just promote my agency a little bit. That 1-800-562-6900 number is a live answer phone. We live answer the phone 9 hours a day, 5 days a week, except for holidays, of course. And we obviously are motivated to hear from you about being a volunteer or getting help with these kinds of questions. But we also provide support about all kinds of insurance challenges that you might be having. So home or life or auto, annuities, other kinds of insurance products. If you have a complaint, we're happy to field those and try to be your advocate in terms of consumer protection.
Wonderful. Well, I think we can wrap it up here. So thank you again, Matt and Tim, and thank you all for tuning in to RPEC On Air. We will see you again. Well, I mean, we won't see you. You'll be listening to us again here soon. Yeah, this might be kind of however you say it, tangential. Tangential. We might be going on a tangent, but it's a good thing I can re-record this. So